Okay, so you've come today on, is it the third part of the courses you've been coming on?
That's right, yes, I'm on the stretching course at the moment.
Okay, and you're an osteopath?
I am, yes.
You are? Okay, and you've done which other parts of the...
I started with the functional active release.
Okay.
And then I went on to do the biomechanics and using the squat test to assess patients. And then today I've got the stretching course, which we've nearly finished.
Okay, so how have you found the three elements? How have they sort of gone together?
They've worked really well together because it's just nice to be able to do a day, and then when you come back to do the next day, that you're consolidating some of the information that you've got already and you put it into practice. And then you're building on it as well, which is really useful. And I think having this final one, you can just see how it all comes together.
Okay.
But having had time to practice in between on the aspects that you've covered has been really useful.
Okay, and what would you say the highlight of today? You've done the stretching course today, so what have you found most useful so far?
Just some really good stretches. Really ones that you know you can give your patients that they'll really feel the difference and give them the confidence to do them, and that they are measurable as well, so that if you can get them back the next time, you'll see how they've improved, and they'll hopefully see how they've improved as well.
Okay, and the functional active release techniques, the actual treatment techniques, what have you managed to, or have you found that useful in practice?
I've used it mostly on the extremities rather than the back. I found it a bit hard on the back itself, but certainly for lower extremity problems and with the arms, like tennis elbows, frozen shoulders, they've been really helpful. Okay. Yeah.
That's very good. And the biomechanics assessments, do you use the squat tests and so on?
I do a little bit. I think it does help. It shows you stuff that you probably could identify in a normal examination anyway. But I think it's a good marker for the patient and for you, and it's something that you can do quickly to assess how far they've progressed.
Okay, so it's useful in that sense. Yeah, okay, but not necessarily for every type of patient.
No.
Okay.
In terms of, I think you can identify areas in different ways, but I think the squat test helps you do it quickly.
Okay, so it's more efficient with your time during in the practice day.
Yes.
Great. Well, thank you very much. I hope you enjoy the rest. Okay.
Thank you.
Cheers.